Hello, welcome. Just as promised, here is part two of my short series on how to learn pathology. And this time we're going to talk and focus mostly about how to learn clinical pathology. Now, I don't currently practice clinical pathology in any great degree, but I have a fair bit of background. As I mentioned before, I spent a number of years in my career doing a variety of clinical responsibilities, ranging from directing a community blood bank to running small hospital laboratories, reference laboratories, and a larger private laboratory as well. So I know a little bit about what's going on there, and I hope that that will help because my process has required learning in each of those domains each time I've taken on new or additional responsibilities. We remember, of course, that the training program is aimed at helping residents to acquire competency in a variety of domains and feel comfortable so that they can practice in those domains with both the knowledge, the skills, the interrelationships, and the talents that they've developed coming to bear across all of these domains, from professionalism to medical knowledge to systems-based practice and so forth. Of course, again, the relative size of these domains in this diagram don't correspond to the amount of time that you need to spend in each of these areas, nor their ultimate importance relative to your practice. Suffice it to say that you do need to possess each of them to some degree in order to be successful as a physician, to care for patients, to collaborate with your colleagues, and so forth. We also recognize that in clinical pathology, even more than in anatomic pathology, progressive responsibility is a vital aspect of the process. And this is sometimes even more difficult to do in clinical pathology because many times the kinds of professional activities that are engaged in by a pathologist can be a little bit more open-ended, vague, you might say, or even nebulous sometimes. But the qualities that you develop in terms of developing your proficiency to becoming a peer to your trainees, your mentors, and so forth, become very, very important. And hopefully all along the range, from looking over supervisory documents to taking call, to fielding questions, to reviewing and signing off these things in the ultimate situation, transfusion reactions or whatever it may be, becomes an important part of things. Now, you'll recall that I used this diagram to illustrate the challenge of trying to put together the puzzle as in anatomic pathology without knowing where the various puzzle pieces fit. Well, this still applies in clinical pathology, but there's some additional domains involved in clinical pathology. So, for example, relationships become fixed in some respects. And so certain aspects of the puzzle are always going to go together. The red cell indices with a red cell count and those sorts of things. And so we have to remember that these pieces have a relationship one to another that is both fixed, but can be misleading or misplaced at times and get out of order. In addition, we have the challenge of the processes that are involved to obtain the diagnosis. And so this makes our problem solving much like working through a maze, where you don't always know where you have to make the right turn or the left turn to avoid dead ends and so forth, to pull things out of the process. So these additional domains to the problem-solving nature in clinical pathology are important to consider, because you have to learn how to solve the problems, both in terms of putting the picture together for the patient, but also in piecing things together in terms of instrumentation and in terms of process and management that is involved in clinical pathology. Now, like anatomic pathology, there still are a number of domains in clinical pathology where morphology is vital, and there are morphologies to learn. and you need to see examples and have those become cemented in your visual memory, just as you do in anatomic pathology. This is particularly true for hematopathology, but it's also true in urinalysis and various aspects of immunology. Microbiology has unique patterns and colors, as well as the wonderful olfactory sense that comes into play there as well. And of course, blood bank also has some degree of morphology, as does the other domains that I've listed here. So don't neglect the opportunity to see what the plates look like, to see what the parasite looks like, to see what the coagulation reaction looks like as you're looking at these, whether they're graphics or whether they're actual patient materials. So growing your knowledge in clinical pathology is a long and complex process, and you really can't wait until you're just on that clinical path rotation to be adding to your depth of understanding to be able to solve the problems that you're going to face. And so you really have to both learn clinical pathology while you're doing anatomic pathology, and of course vice versa, because there's a tremendous amount of clinical pathology involved in doing an autopsy or in evaluating a surgical pathology specimen. Liver biopsies are a prime example, but there are other circumstances. You may think just of the chemistries, for example, with a liver biopsy, but there are viral serologies, there may be microbiology results, coordinating when you're seeing a fungal infection with what you might expect in terms of the culture characteristics and so forth. Those are all good questions to be asking yourself and useful to expand the domain, expand the size of the room that you have for that particular diagnosis. Likewise, you have to reach back to some of your basic science education to be able to really do clinical pathology well. The more you understand chemistry, physics, immunology, and the basic science of molecular interactions behind those, the more you understand the molecular biology of things, the easier it will be for you to acquire and expand on your knowledge as you move into the case-by-case knowledge of clinical pathology as well. Now, the wonderful thing about clinical pathology is that you have a lot of help. There are a lot of very capable people around you from whom you can learn, and they're often readily there to help you. So, for example, medical technologists are an amazing source of information and experience, and oftentimes can be very helpful to you in understanding what's going on. Additionally, because many times as a pathologist, you'll be involved in both teaching and directing them, you need to learn what they're seeing and what they're doing. So shadow some of those technologists, watch over their shoulders as they run machines, as they perform assays and so forth. Look at the procedures that they're following and ask yourself, why? Why do they do it this way? Why is this the procedure, not some other way? And likewise, look at what they're doing in terms of quality control or other quality or instrument maintenance records that they're keeping, because those also will come under your domain and purview as a laboratory leader. Those are great resources to learn from, and I encourage you to make the most of that. Likewise, your clinical colleagues can teach you a tremendous amount about clinical pathology, because they will bring you the questions, they will bring you the problems. And you need to find interesting problems and challenging problems in ClinPath to solve, just like each day is going to bring you in the surgical bench a new set of cases and so forth. Well, each day in the clinical laboratory or on rounds, you can find additional interesting cases or problems. These may arise through a phone call to the laboratory or being on call at night. The medical technologists or other lab personnel may bring them to your attention. You may hear about them in tumor board with unusual presentations or something, or on clinical rounds when they say, oh, this is just a lab error, and you go, ooh, maybe this is something else going on here. Because we understand more about the lab testing than sometimes they do, even though they may see the discrepancies or the outliers and so forth more readily than we do. Likewise, in this fashion, shadowing your lab director to see what problems come their direction, whether those are management problems, personnel problems, procedure problems, instrument problems, budgeting problems, those kinds of things are all valuable to learn as you contemplate becoming a laboratory director. One of the great ways to learn in clinical pathology is to take on projects, to learn by doing things, to participate in an assay validation or establishing a reference range, calculating those and seeing how those are done, or more valuably even to set up a new test or to develop a new test. These are tremendous experiences to help you. When problems arise, doing a root cause analysis, or when there's a quality improvement project that needs to be undertaken, this is a great way to get your fingers greasy in the work that goes on to make laboratory medicine a quality experience. And many of these things, particularly informatics projects or public affairs or other sorts of things, can run over several cycles of time. So they don't always fit comfortably into a single time-based rotation, but you still need to take those things on and work them through to their conclusion if you want to acquire the skills and the perspective that's going to help you in doing that. Now, I mentioned here inspection events also, because those also can give you a great exposure to what's going on in the procedure manual, how it's documented, how you verify things, and where there may be problems hidden that are easily overlooked otherwise. Now, laboratory management is not exclusively the domain of clinical pathology, but I mention it here because it is so important to your development as a pathologist. It's said that in pathology, we have to have a higher level of leadership, and it's because we're so often involved in laboratory management. So learning and searching for the opportunity to shadow your leaders is very, very important. Studying case experiences is also valuable. And this has been demonstrated a long time hence in the case method that was pioneered in teaching business school students at Harvard. And they followed this kind of read the case, discuss it in class, engage, reflect on that, and see what's to be learned. It's the same sort of thing that my colleagues and I tried to follow as we wrote this book for pathology practice management, was to provide case examples and let people think through those, review some of the mistakes as well as some of the opportunities that might have been present. And you just don't get this by reading a book or sitting in the classroom. You really get the best experience by talking to people, by shadowing them, by attending the meetings with them, by hearing what's coming up and seeing what's going on. Now, just as there were in clinical pathology or in anatomic pathology, a host of resources beyond the domain of the four walls of the 5 or 6 books you've got on the shelf, there are a number of very rich resources out there on the web and in books and so forth that oftentimes interface with digital pathology, my passion, as well as the sort of screen-based learning that we think about. So videos like this channel from the blood bank guy covering all the basics of blood banking that you really need to know. Hematology, Eric Glassey's wonderful atlas comes complete with QR codes. They'll take you directly to digital slide smears and allow you to interface and react with them as a whole rather than just a single couple of fields. Likewise, you'll find great lecture material on Pathcast across the whole spectrum of pathology, but there are some particularly good ones in micro topic areas that aren't quite as often addressed in other materials. There are other domain-specific resources such as, this Dr. A's clinical lab videos have a host of things both in basic science as well as across the spectrum of laboratory medicine. There are a number of special web pages such as this Learn Heme page from Great Britain that focuses on coagulation. And then some of the organizations like ASCP and API have projects like the Pathology Informatics project called Peer Management Learning from Laboratory Management University, something that I had a hand in helping to develop, as well as Molecular, the training for residents in immunogenetics, or excuse me, in genetics and molecular biology. So keep your eyes aware of those. You can find those through searching. You can find them from forums with other residents and trainees and so forth. Now, a technology or a technique that we didn't talk about in learning AP, but certainly applies there, also can apply in clinical pathology. And that's to make diagrams, get a whiteboard or get a large sheet of notepad paper and draw out the cascades, draw out the pathways, compare and contrast. This wonderful educator, my friend Abhijit Das, has put together some wonderful review sheets in AP, doing just that, giving some diagrams, some verbiage, compare and contrast kinds of things to help his trainees learn key concepts in AP. Well, you can do very much the same thing with clinical pathology, and that can be both a personal as well as a shared resources, depending on how good your artwork is. And of course, apps are out there in clinical pathology, just as they are in AP, that can really help you to use your time wisely for chunked learning when you're waiting in a line, waiting for the bus, riding on the subway, waiting for somebody to come pick you up or whatever it may be. Look for these apps that can be useful resources. So here's some of the microbiology ones and so forth. There are several heme ones that are particularly good because they have quizzes associated with this. So the Cellovision Cell Atlas will quiz you to see if you're as good as their artificial intelligence schema in assigning and identifying various heme cells, as well as the Hematology app has even more about interfacing with therapeutics as well as morphology and wet heme findings. And of course, if you can share Anki decks, that can be a great resource as well. We shouldn't neglect the fact that just as in AP, you can learn from a variety of teachers, and you can become really internationally connected through the various social media platforms. So one of the ways to do that is to find Facebook groups of interested people. This one, a medical laboratory scientist, covers a variety of topics in medical laboratories that would be pertinent for residents to learn. Likewise, following on Twitter, some of the Path Twitter may bring up a lot of AP topics, but also has a good, rich number of clinic path topics as well. So use these tools, chunked learning, many mentors, to reinforce your learning that you're doing at the bench or from the books and so forth, because these can be very, very valuable to you. And, then I think you also need to make it fun. So personal insight here. Here I am teaching medical microbiology to my 6-month-old son. It was one of the fun memories of our lives to lie on the floor and look through some of the mycology books or other basic texts that I had to look. Of course, you want a light book if you're going to do this, because they're not always key for long-term attention spans. And also, you can make a game out of it. So gamification has become a very big topic in pathology education, whether it's a pathology pyramid or Jeopardy or whatever it may be that you can devise with your colleagues, your fellow trainees, or with your faculty to make it fun and more engaging. Don't neglect the opportunities for education through the various organizations that are very active in the clinical path field. So you're undoubtedly aware of the CAP and ASCP, but AABB, AACC, ASH, ASM, AMP, boy, look at all those A's. All of these organizations have roles and educational materials in the ClinPath field that can be very, very useful to you as a trainee. And depending on where your passion is, you may want to be engaged in participating in their meetings, attending them, submitting abstracts or other presentations to their consideration as well. Now, just as we saw in in anatomic pathology, there are mimickers, there are interfering substances, there are abstractions of various things. The same can be said for clinical pathology. There will be imitators, and you need to learn what those imitators are. There will be interfering substances. There will be cross-reactors. These kinds of things come up in ClinPath the same as they do in anatomic path, and you need to be aware of those. And and begin to catalog some of those pitfalls, some of those things, because that's what's going to give you the depth of experience and the ability to distinguish good from evil, as it were, and also to become a better consultant. Remember, as Dr. Valdez said, you don't have to know everything. You just have to know what you don't know in order to be safe. You need to know what you don't know. Now, her approach to AP may apply in some similar ways to ClinPath. As you take a problem on call and you develop your answer, before you go present that to your attending, make up your mind, commit to something, and then be aware of how closely you have come. Be hard on yourself. Hold yourself to a high standard, but through that process, learn where the boundaries of your knowledge are. So learn where you may be unsafe, as it were. Finally, learn from every case. I can't emphasize this enough. Don't let the patient leave your office before you've learned what they came to teach you. Indeed, each of these problems that you encounter as a trainee is there to teach you something, whether that's something about professionalism, whether that's something about farming, whether it's something about the environment or other aspects of science. There's something there for you to gain, and don't let it get away from you. That's the rich treasure that your training program offers you. So to summarize, we need to approach clinical pathology aiming not just to learn the medical knowledge, not just to learn the skills, but to learn both the processes and the interrelationships and sort of the management side of things as well. There are a host of digital resources in ClinPath, just as there are in AP, to expand and test your knowledge. And you'll want to use the case method, both for the patient knowledge sorts of things, but also for the processes. And to do that, you need to take on projects. Don't be afraid of projects. They are where you learn. Likewise, learn from your mistakes. Learn from those times when you thought it was leukemia and it was just benign lymphocytosis. Learn from those sorts of things from every case. And engage in ways so that you can see lots of training cases. In ClinPath, as in AP, it's important to see a lot. You have to get your hours up, as it were. Use all of your time. Use your chunked time and so forth, and make it fun. As you work with a variety of teachers, you have to make it fun. Your goal, to become proficient, it's going to take a long time, 10,000 hours. That's the rough estimate that Malcolm Gladwell puts forth. And I would have to agree with him that it really does take about that much time. Now, sadly, in some ClinPath programs, the demands may not be that great, and you may not need to put in, or seemingly be required to put in more than 4, 5, 6 hours a day to be able to cover your duties. That is sadly all too often the case. But you will be the worse if you only put in that number of hours. So if you're not getting that number of hours demanded of you during your training time, on-site time, you're going to have to put it up in other ways, doing that after-hours chunked learning, doing that after-hours video review, doing that after-hours book review, or connecting with colleagues elsewhere to do that. So finally, it's a journey, and enjoy the journey that's ahead. You'll find it to be a very rewarding field and a very engaging process. And my hope is that you'll be the better for it, and our patients will be the better for it. And if you have comments on this video or feedback on other things you'd like to see covered, or things that I should have included that I left off, please don't hesitate to drop me a note. Make a comment or send me an email here at the OU Health Science Center, and I'll be happy to respond. So until next time, thanks so much for joining me.